Hello, good evening. It's long been argued by those in favour of legalising cannabis that doing so would be a money spinner for the public finances. Now, Newsnight can reveal the Treasury agrees. We've got an internal document that concludes there could be hundreds of millions of savings through tax revenue and also cutting police and prison costs. Yet the Home Office has said it has no plans to change the law on cannabis, currently classified as a Class B drug. Well, tonight the House of Commons debated a move to legalise the production, sale and use of cannabis, prompted by a petition signed by over 220,000 people. Nick Hopkins reports.
For every battering ram raid, there'll be two more. For every plant felled, another crops up. The British appetite for cannabis appears huge. For many police chiefs, it's a losing battle.
You look at the last 40 years of cannabis prohibition, and it's quite clearly been a hugely costly, counterproductive and harmful failure. The supply has gone up, consumption has gone up, and of course criminals, gangsters are in charge of the market, and they're making huge profits.
Money that's gone up in smoke. Money campaigners say could be made by the state if the drug was regulated and taxed. And they might be surprised to learn the Treasury agrees. This document is high on Whitehall nuance and caveat, but concludes legalising would generate notable tax revenue and lead to overall savings to public services, up to £200 million in policing and legal costs alone. It's not just about hard cash. This report notes that thousands of people with convictions for minor offences find it difficult to get work. They're effectively scarred for life. The Treasury crunched all these numbers at the behest of the Lib Dems when they were still in power, but the report was never published. Now the party wants to change the law. They say this war is lost, but not everyone agrees.
If we were to have lost the so-called war on drugs, which I don't actually think we've got, we've simply deemed certain substances illegal. If we were to have lost that, then the prevalence and the use of those substances would be on a par with the legal substances, tobacco and alcohol. But in none of the cases for the currently illegal drugs is the level of their use anywhere near that for alcohol and tobacco. So I think that's the most persuasive evidence suggesting that legal prohibition does have a role to play in stemming what might otherwise be an escalating level of drug use in the UK.
Cannabis use in the UK does seem to have fallen and then flatlined, but that still means 2.2 million smokers last year, and they went through 216 tonnes of the drug.
Can this get any better?
Skinning up in Colorado, America is leading the way on legalisation, but could the tide turn here?
The whole debate has shifted, I think, dramatically now as we see state after state starting this debate. Many states in the United States of America deciding to establish legalised, regulated markets. And of course, the basic principle, it seems to me, is do you put a potentially dangerous product into the hands of criminals who have no interest in your welfare at all, or do you seek to regulate it? And I think in terms of public health, protection of individuals and avoiding the ludicrous criminalisation of so many young people, a regulated legal market makes a lot of sense.
We're looking at
223,000 people signed an e-petition to force MPs to debate legalisation today. They were not in the Commons, but in the MPs' equivalent of a chill-out room, Westminster Hall.
Police officer warrant!
While the hunt for the dealers continues, a number of police forces have already made it clear they won't prosecute people with small amounts of cannabis. Others may follow.
If you haven't got a problem with drugs, the last thing you need is policing. And if you have got a problem with drugs, then the last thing you need is to be prosecuted. And so we've got a growing realisation amongst police at all levels that it isn't working and it's wasteful.
But the Home Office appear unmoved. They told us,
the government has no plans to legalise or decriminalise cannabis. There is clear scientific and medical evidence that cannabis is a harmful drug which can damage people's mental and physical health and harms individuals and communities.
That may be true, but with police forces facing massive spending cuts, cannabis could be legalised by default.
That was Nick Hopkins, and joining us now from Washington is Kevin Sabet, who's advised the Clinton, Bush and Obama administrations on drugs policy and is now the founder of Smart Approaches to Marijuana. Here in the studio with me is Niamh Eastwood, the executive director of the drugs charity Release and a member of the new Lib Dem expert panel on cannabis legalisation. And welcome to you both. Thanks for joining us. Niamh, if I can start with you, if there are these savings of hundreds of thousands of pounds, we hear up to £1 billion, should that kind of saving become part of the equation?
Well, it certainly should become part of the equation, but I think we have to look at this more broadly. First question we need to ask ourselves is, what causes more harm, the drug or the policy? And in our view, it's the policy that causes the most harm. Every year we criminalise anywhere between 60 to 80,000 people for possession of drugs, for personal use of drugs. That's primarily driven by cannabis, with 70% of that number associated with cannabis possession. And the damage that that does is really quite significant for individuals. It affects their employment, their education, and other things that we would take for granted, like travelling to other countries. What's really important to remember is that this can have real impact on an individual. And a research piece from Essex found that 19% of the lifetime income of an individual, that if an individual has a cannabis conviction or criminal record, will reduce their lifetime earnings by 19%.
OK, so you're talking the Norman Lamb line, which is basically don't put a potentially dangerous product in the hands of criminals. If I can turn to Kevin Sabet, and you've overseen what's happened in Colorado and in Washington, where they've legalised cannabis for the last, year, 18 months or so now. Are those states the richer for it? What's the lesson?
Well, there's certainly a group making a lot of money. It happens to be the industry, and we actually call them Big Tobacco 2.0. The small group of people who really are getting rich off of addiction and infiltrating special interest groups, advertising things like cannabis gummy bears, lollipops, and candy bars, and targeted towards kids. Because you're having a story later, I heard, about developmental disorders. Cannabis is a developmental disorder, also cannabis use for young people. And if you're in the industry, you have to get people young. Let me tell you, there are no new schools or new hospitals or new parks constructed because of all this so-called tax revenue. In fact, we have all this tax revenue for alcohol and tobacco, as you do in the UK. I'm waiting for there to be treatment on demand. I'm waiting for the schools to be constructed. They're not there.
It does seem very funny for you to be arguing essentially for more big corporations to take care of these drugs in the same way that big tobacco or alcohol does.
Well, firstly, that's not
well, it's
what we're
unbelievable.
arguing.
The interest
Sorry,
groups
Kevin.
are the interest. Well, that is the reality. And,
sorry, one second, Kevin. Let me just go back to Niamh. Yeah, sure. One point.
Sure.
I mean, that's not what we're arguing for. We're not calling for a super commercialised model.
But that's what's going to happen.
Regulatory control.
I
don't think so. If we look at tobacco, for example, tobacco's a really good industry where we've evidenced how public health interventions can fundamentally change levels of use. So 30 years ago, 1 in 3 adults in the UK smoked. That's now down to 1 in 20,
and
less than 1 in 20.
We've just heard it's flatlining.
But the problem is that when we have a market that's controlled by criminals, we have no control over that market.
Kevin,
we can't do the effective public health
that
interventions.
has happened in, well, I'm not going to speak over her, but that has happened in tobacco because we've become more anti-tobacco, not more pro-tobacco. So tobacco's been legal for a century. It's not all of a sudden going down because we've realized it's legal. It's going down because of the
Kevin,
stigma associated with tobacco.
If you legalise something, is there ever confirmation that that product becomes less popular?
Well, I'm not sure, because you're not going to legalize it for 15-year-olds. So you're still, unless Niamh wants to do that, I don't think so.
No,
you're still going to have 21. Of course you don't. Absolutely. And I agree that you don't. I'm glad you don't. But that means that will still be illegal for those under 21. So if you're trying to get rid of forbidden fruit and make it cheap to, the black market is thriving in Colorado. Let me tell you, it is thriving there in Colorado because demand has soared and the legal industry is taxed because we're so-called wanting to get revenue. So the black market is there to undercut the legal market, just as they are with cigarettes, in fact, in your country and in mine.
So why, if something is flatlining, if it's growing less popular, what would be the point of legalising it? Niamh?
Well, the point at the moment is, Kevin brings up the point about age. You mean, at the minute, any young person can buy cannabis from a dealer. The only ID they need is a £10 note. We can't do anything to change that. The point is, we've handed this market over to criminals. There's no way we can do things like age control, purity controls. There's no way we can reduce the harm
How's that working out
associated
for
with
alcohol?
drugs.
How's that working out for tobacco and alcohol? When we look at the binge drinking
the reality
rates
is we
in the
cannot,
UK, when you look at the alcohol rates in the UK.
Let Niamh answer that then.
Kevin's arguing for the status quo. He is arguing for a drug that he believes is harmful to be in the hands of criminals. That's what he's arguing for. What we are arguing for is a policy that will pursue public health responses, that will make sure people are safe. You mean, again, back to tobacco.
Niamh, we're in agreement there, because I want public health responses
when we raised
as well.
the minimum age for tobacco use from 16 to 18,
we
saw the level of young people's use drop from 24%
But the point
to
is,
17%.
when it's prohibited,
we can do that when it is.
We can, but when it's prohibited, less people use it. And the bottom line is, in the UK, there's been incredible success no one's talking about over the last 10 years of the reduction of drug-related deaths, the reduction of all drug use, especially cannabis.
We have one of the highest rates of drug-related deaths, and actually the most recent statistics are the highest on record.
I'm so sorry,
Kevin.
We've run out
your
of time.
Statistics are wrong.
Thank you both very much indeed.
Well,
We've run out of time, but we appreciate
me.
your time.
Thank you.